I like the Academy's annual meetings because they are focused on quality education, that is, clinical evidence-based medicine.
We cultivate research, we disseminate scientific and clinical knowledge, and foster, hopefully in optometrists, a commitment to lifelong learning. So the vision statement for that is today's research, tomorrow's practice. So what you learn today, you'll go home and implement for better patient care in the future.
It's really a rich environment. It's become a lot more than what it originally started as, which was a group of people who just wanted to push the profession further. And I guess that goal or that ideal has resonated with a much broader audience.
The Academy. Some may think of it as just simply an organization. For many of us, it is the place for lifelong learning in optometry. But as you are about to discover, the Academy is more than a meeting. Much, much more.
The best of the best when it comes to clinicians and the best of the best when it comes to scientists.
Yeah, well, the Academy plays a central role there because it really is the only venue where vision scientists like myself can interact with clinical optometrists and share ideas and experiences. It's the only real venue for that.
That's basically all the lectures I've been to have been some sort of disease-based, and they've all been excellent. So I think the best CE is always at AAO, so I always try to make it to this meeting.
Another really awesome thing is that the exhibit hall is always full of exhibitors that want to show you their product, how it might work for you in your future clinic.
We want to ensure that we as the Academy, we are at the leading edge of research, science, education, but the technology piece also goes with it. And so what we wanted to do was, again, embrace the technology that is now available to us by the smartphones, the tablets, the PCs. We see that in the classroom. We also want to showcase that for our attendees as well. You can go ahead and download the handouts. You can go ahead and track your schedule. You can download your evaluation, and just by simple radio button pushes on your smartphone, you can submit that information, or you can download that information.
You know, some of my favorite parts of the Academy are the paper and poster sessions.
I had a poster yesterday afternoon, so that was on optic neuropathy, so it was very interesting, and it was good to mingle with all the other people who had posters as well.
And again, it's a unique presentation or a unique format where you can, peruse months and years of work in a very short time period, because many of these posters, they show up in a single flash. You can read what took 6 to 9 to 12 months to develop.
They're just amazing papers and posters that are being presented. Some of the research being done at VA hospitals, to some of the research being done at the universities, to private practices.
What makes the Academy's annual meeting, like this one in Phoenix, so special for so many is the unique opportunity for the individual to pick and choose, to customize the continuing education process to their own needs.
And we do allow people who come to the meeting, which is one of our traditions, to change their mind in the middle of the day. If you don't want to do the contact lens course, you can go see the glaucoma course. You're not committed into a pre-scheduled plan before you get to our meeting.
We're able to attend many different classes, which is great. You can choose anything between ocular disease, you could choose a pharmacology class, anything to contact lens, or even pediatrics, so it's a very great experience for me as a third-year student.
It's really so organized in getting the perspective of both clinic, and of late I think they are increasing more clinical related research aspects as well.
In addition to specialized lectures and presentations, the Academy offers lots of forums where attendees can mix and mingle.
But I still get to see a lot of people every year that I don't get to see but once a year. They are kind of like my optometric soulmates.
It's really nice to have some social aspects as well, to mingle and to meet other students from other schools.
If you have food, the students will come.
It gives the students the opportunity to look at all the various programs. All the residency programs are very unique. So if you would like to work in primary care, if you would like to work in disease or pediatrics, to find a residency that's right for you.
Still others are drawn to the personal and professional challenges of attaining fellowship in the American Academy of Optometry.
Why did I become a fellow? To join one of the most prestigious, one of the most prestigious groups of optometrists in the nation.
You have a point system. You need to get 50 points of written work. 20 of my points were my master's degree, and then posters and case reports also count. And you do all that hard work, and then you sit for an oral exam and do your best at that and become a fellow.
I guess there's a lot of clinicians who are fellows, but there's also quite a lot of researchers and really high-profile researchers as well who are fellows also. So I guess it gives you the opportunity to connect with more researchers also.
Fellows, I think, are particularly interested in moving the ball forward with what we understand about patients' vision and their eye diseases. This is our first time that the special interest group has done any research. So our idea is that by going to observational kinds of studies, that we can help to describe some of the unknown relationships between things. For example, what we did here is we tested tear osmolarity, that's how salty your tears are, with a new widely available instrument against a validated questionnaire of dry eye symptoms.
I've been very fortunate. Esler was giving me a student travel scholarship this year, so I was able to come and attend the meeting.
Student fellowship program was started just last year. It's in its second year.
It's basically a way for students to get more involved in the academy, to get a student fellowship before they become an actual fellow later after graduation.
Fellow to me really means that you are making a commitment to the profession to continue contributing.
Above all, the Academy fosters an atmosphere of accessibility, or for lack of a better word, approachability.
In a meeting where suddenly you're standing next to the world expert on a topic and having a chance to talk and interact with them, it makes the topic real, it makes it accessible, and I think in some regards it maybe inspires them to think, well, I could do that someday.
And I really think the Academy meeting is really the best place for optometry students to present their research work, because the environment is a lot friendlier. Most people have similar interests and background.
Being a part of the Academy, like I said, it puts you in contact with a lot of these people that you cite in papers, and you're researching and learning what they did. And I think it's really important. It's just a place that we can, meet and have something in common for one time a year.
I think, all the senior doctors, they're very great because they're very influential to us. They're always promoting us and saying, hey, thank you for coming out to these meetings. We really appreciate your efforts and everything that, that we do, and we appreciate their efforts for everything they have done in the past. So it's a really great experience, that we're able to connect.
Throughout the year, our internet site enables members to take advantage of a wide range of online services. It's where you can find out how to become a fellow of the Academy, or seek out a section that's geared to your specialized area of patient care or to vision scientists, researchers, and educators. In short, the American Academy of Optometry exists to serve the diverse educational needs of our ever-expanding profession. It all comes together each and every year here at our annual meeting, the place for lifelong learning.
Well, I take home ideas to go back to the drug table, do more research, both in the clinical research and then basic research.
What keeps me coming back is that every year I learn a little bit more, and every year I pick up nuggets that I'll eventually take back and implement in practice and in seeing patients and taking better care of patients.
Get ready to boogie. Put your running shoes on and go see as many classes as possible and go to all those events and get yourself out there.
I might get tired at the Academy, but I never get tired of the Academy.